Deborah, it's not recording automatically?
It did, but because I was the only one on
Okay.
at first, I paused it. I'm so
Okay.
technological.
Just want to make sure it worked.
Yeah, now it is recording. It's
Okay.
recording now. Yeah, I had paused
great.
it just until everyone got on.
Okay.
Why don't we go ahead and get started, just so we're respectful of our friends from Siloam's time. I'm Leslie Kirby. I'm the chair of the Community Relations Committee of the Jewish Federation and Jewish Foundation of Nashville and Middle Tennessee. This is our first and what we hope will become a weekly series of virtual lunch and learns. And we've decided to do it for two reasons. One, to try to be informative, especially right now around the pandemic. So our first few sessions are really going to focus on various aspects of life around the pandemic. But the second goal of the program was also to try to build community. So at a time when we're not able to come together for physical programming, we hope that this series will be a space where we can come together as a community to bond and ask questions and just be together. So for today, we chose public health as our first topic, and we are fortunate to be joined with Amy Richardson and Lauren Smith. Amy is the Chief Community Health Officer at Siloam Health in Nashville. And they're going to be offering their kind of firsthand on the ground perspective of what's going on in terms of community health in Nashville surrounding the pandemic right now. So without a lot more from me, I'm going to turn it over to Amy.
Great. Thank you guys so much for letting us be your first guests. We're really happy to be able to go first, so there's no pressure for us. You guys may just get better from here. But we are really thankful also for the opportunity to share about the work that we're doing. We're seeing a real opportunity for us to educate not only our typical patient population, but also the broader city about the needs that are emerging as a result of the coronavirus in Nashville. So if you're not familiar with us already, Siloam Health is a faith-based nonprofit, and we provide whole person care for the culturally marginalized. So we provide whole person medical care for the underserved, which is mainly the uninsured, and we promote community health among marginalized immigrant and refugee populations. And then we also offer student education for the next generation of healthcare providers. So those are our typical services. We are almost 30 years old, but still a fairly small nonprofit. So we have not set out to serve only immigrant and refugee populations, but over the course of our history have become known, particularly within those communities, as a place to receive whole person care. And what I mean by whole person is that we don't just provide medical care, but we offer behavioral health services, we offer spiritual support, we offer just community work so that the social determinants are also addressed. So we have a social worker and community health workers as well. And just to be really upfront, we are a Christian nonprofit, but we serve people from all faiths or none. So that doesn't impact the way we provide care or who we care for. So that's a little bit about who we are. I'm going to start by giving us kind of a bigger picture of what is happening with COVID in the city of Nashville right now. If you are listening to the mayor's press conferences or the governor's press conferences, then please know they are much more authoritative than me and have a bigger picture of what is happening at a broad city level. But just so you know, from the mayor's press conference, I'm stealing this information from this morning. We're at about 2,100 confirmed cases of COVID in Davidson County, which is a small increase of 32 in the last in the last 24 hours. And we have confirmed cases in ages from 2 months all the way to 99 years. So we're seeing this affect the city at a broad level. But I think one of the pieces that I want to draw out is that if you have seen heat maps of where the cases are clustering in Davidson County, we've seen some change over the past week. So I think it was last week or so, the data was reflecting there was a spread over all the somewhat densely populated parts of Davidson County. But in this past week, we've seen a real emergence of cases in the South, in the Antioch area in particular. And if you're not already aware, that's an area that's largely populated by refugee and immigrant populations and other more marginalized populations. And I think one thing that's really essential to know is that it's, to me, a lot of systemic issues that foster that clustering. So a lot of our refugee and immigrant populations work in essential jobs. And so unlike me and Lauren and probably many of you who are working from home right now, Lauren does go into the clinic some days, but I've been working from home for a full 6 weeks now. A lot of these essential workers have had to make the choice to either go to work or have no income. And so that's not really an option to have no income, because in low wage jobs, they may not have the savings or the sick leave in their workforce that we have the opportunity to have. So they've chosen to keep going to work. And a lot of the exposures have happened in workplace settings, unfortunately. And there are some other systemic issues as well. So the education about COVID and resources available to those impacted have been less readily available in languages other than English. So even though some of these populations speak English as well as another language, some of the first materials that were coming out were very technical and not even clear to those of us that have English as a native language. And so it's taken a bit of time to get the information out there in readily accessible languages. We've also noticed some challenges in distributing information. So some of these communities have challenges in accessing they may not have computers at home, or they may have a harder time if there's not a radio or TV station in their language. So we do have some Spanish press conferences happening, but if it's a language other than Spanish, then there's continue to be some challenges in getting out the information to them. So one thing that Siloam has been doing, and then I'm gonna let Lauren jump in to give a deeper look at what Siloam is doing, and then if you're not aware, things to be aware of from COVID itself. But Nashville is a place where there are lots of healthcare environments, but Siloam has become a home to many refugee and immigrant communities. And so they're already trusting us. We already had programs in place, such as our community health worker program, where there are members of these immigrant and refugee communities that serve as liaisons between the health system and social service systems. And so they've been trusted messengers for COVID education and teaching about how to prevent the transmission of disease and where to find testing once testing became available. I will stop there and let Lauren jump in, or if you all have questions, you can either type them in the chat box, I assume, or just interrupt.
Yeah, before I start, anybody, and you'll have to unmute yourself if you have questions. Okay, well, I will, oh yeah, go ahead.
Quick question. So how is that language issue being addressed, or is it being addressed?
Yeah, so there is now COVID education flyers, in so many languages. So it's not necessarily a problem of finding translators for what is COVID, but I mean, if you think back to the first time you remember hearing about COVID, like you might have read about it, but really having someone to digest it with and hearing it multiple times. So just the fact that it's been translated into these particular languages doesn't necessarily mean that communities are really grasping all the complexities of this disease that many of us are also still feel somewhat confused about. So we have been working with other key partners in the immigrant and refugee communities, as well as leaders, trying to identify leaders from within the different language groups. So they may be faith leaders or other, some communities have kind of their own like ethnic social group kind of things. And so working with leaders and trying to get the information to them and serve as a resource if they have questions so that they can share that information. And they do it in a variety of ways. So some of them are hosting Facebook Live streams. I know one community had a doctor who spoke their language do like a live Q&A for them over the weekend. And so some of them are sharing over an app on the phone that's called WhatsApp, which is used really commonly in some of these communities. So they may be distributing information. And then, as I mentioned before, there are press conferences that the mayor's office is doing, and some of the other Spanish-speaking nonprofits are streaming that are more regular. And I think information is being shared on Spanish radio stations as well in Nashville.
Thank you.
And then I can speak to that from a provider standpoint as well. So as Leslie mentioned earlier, my name's Lauren Smith, and I've been a family nurse practitioner at Siloam for almost 7.5 years. And one of the things I love about it is working with the refugee and immigrant population. And this has been, really hard on everybody. I think adjusting to a new normal, but really seeing the fear and lack of education for our refugees and immigrants, and many of our patients already having a low health literacy, understanding disease process and things like that, has made this really challenging. One of the things Siloam has done to protect our staff and our patients is switching most of our clinic visits to phone calls. We are working on a telehealth medicine platform, but we also wanted to make that really accessible to our refugee and immigrant populations who don't always have FaceTime on their phone or don't have a computer at home where they can just log on to an app and do a telehealth medicine visit. But we did find a platform, thankfully, where they don't have to do that, and we plan on launching that in May. But what we did start doing in all of our phone calls is integrating kind of 5 social history questions. So for example, I will call, I had like 8 telephone calls yesterday, and I would call the patient and I'd say, we really want to talk about your diabetes, but we also have just want to check in and connect with you because we know this is a really hard time for everyone in the city. And so a couple of those questions are, do you have sufficient food right now? Because we know many of our refugees and immigrants, like Amy said, are working low wage, low paying jobs. And if they can't go to their job, either they're reduced hours or say they're undocumented and they did housekeeping and now nobody wants anybody else in their house unless you live there, are really struggling financially. So one of the questions we ask about is food resources. The second is if they have enough money to pay their rent and their bills. Because we know that these social determinants of health, if I'm calling somebody about their diabetes and I want them to go pick up a medicine that costs $20, which may not be a lot of money, but they can't afford to buy food for their family, like it's not a non-compliance issue for them. It's I have to make this choice and this is my basic need. And so just really understanding that as a provider. So we ask those two questions. We also ask about their access to health information about COVID. And so the way I usually phrase that question is there's a lot of information out there. A lot of it is good information, but a lot of it can be really confusing. What do you know about COVID? And then do you know what some symptoms are? Because we want to really educate our patients on, like, if you have cough, shortness of breath, fever, if all of a sudden you lose your sense of smell, and I'm not talking about like nasal congestion, but if that happens, you really need to call us and contact us. And we have set up our nurse triage lines where they're checked every hour to 2 hours. And we have nurse triage lines in English, Spanish, and Arabic, because those are the main 3 languages spoken in our clinic. And we're talking to them about, like, if you have symptoms, you need to call us and we'll talk with you about where you can go get tested, or we'll triage you over the phone and decide if it's not really COVID, but it's something we need you to come in and be seen at clinic. And there's so many directions we can go. If you guys want to talk about symptoms of COVID-19 and presentation and incubation and all that, we can go that route. I can also tell you what we're doing at Siloam just to help prevent the spread, and also just good prevention tips for you all. If you want to do all that, we can do all that, or we can hit one of those topics, whatever you guys want to talk about.
If you could give us a sense of what you're doing in the clinic first, and then maybe talk about prevention and containing the spread in the general population as well. I think a lot of people have concerns, especially now that we're talking about reopening, of, you know, what do we need to continue to do to be safe, even as we have people telling us like the world's back open again?
Yeah, that's a great question. So the things that we're doing at Siloam, and thankfully our medical director, Jim Henderson, who has done a lot of international medicine and worked in India for several years before coming back and joining Siloam, saw this problem early on before people were saying, hey, we really need to shelter at home. Jim said, like, this could be a really, really big deal. So we at Siloam need to have an outdoor clinic at the far away from the entrance of our clinic to see anybody that has any symptoms of coronavirus. We do not want those patients that are suspect to come into the clinic, sit in the waiting room, come in and be interacting with the providers. We are a smaller staff. We have 4 MDs and 4 mid-level providers, so nurse practitioners and physician assistants. And so we want to protect our staff so we can continue to care for patients. So probably the first week in March, when we found out about some of the first cases in Davidson County, Dr. Henderson said, we need a side clinic. We need an outdoor clinic where we're triaging patients so they're not coming in to our waiting room. So we already have a greeter at the front door. So even before you get into the clinic, the greeter asks the patient, and we have a sign, a big placard too, in Spanish and Arabic and English with kind of pictographs of symptoms. So cough, fever, shortness of breath, sore throat is one of them, headache is one of them. So these are all generalized symptoms, right? So it's like, well, do I have allergies or do I have COVID? But we're just being super cautious. And if they have any symptoms at all, or if they say, well, my neighbor tested positive and I'm worried I have it, they get sent to the side clinic. The greeter has a walkie-talkie. It's the first time I ever got to use a walkie-talkie professionally, really enjoy it. And they say, hey, Lauren, we're sending a patient over to you at the side clinic. And I say, great. I have my awesome like face shield. I've got my N95. I've got my other mask on top of my N95, and I've got a gown on. I look really, really awesome. I'm hoping that these pictures go public soon. And I assess the patient, you know, and we don't have our laptops out there. So it's really kind of going back in time to medicine, but we assess the patient, we make sure they're stable. So making sure they're not having respiratory issues, which is one of the big things with this illness. And we decide whether or not they need to be tested. Now, early on, we didn't have the ability to test. We're getting slowly trickling in some more test kits. And then thankfully, Deborah had already mentioned this, there are a lot more testing sites available now than there were when this all started. So we decide if we need to test them, or potentially, let's say, and Amy and I can talk about this later, like the immigrant and refugee population, there are often 8-9 people living in a house together in a very cramped, crowded space. And I don't have the ability to test 8 people back to back to back, especially if only 2 of them are showing up to talk to me about their symptoms. So in that case, I would recommend, like, hey, here's a letter from Siloam saying that we have high suspicion you have COVID. We want you to go to this testing site. This is the phone number you can call. In the case of that family where there were, I think, 6 adults and 3 children, and one of the children had tested positive, I said, I want all the adults to go, or at least 2 of the adults to go. Because, you know, and as a professional and just as a person, you're like, you got 9 people living in a house with a 3-year-old that's not going to cover their nose when they sneeze or cough. So we assume they all have COVID, but sent a letter to them to get tested at the testing site, and actually called ahead and said, these patients do not speak English. These are their names. And I have high suspicion, and they're going to come get tested tomorrow on a Wednesday. So, so side clinic for any suspicious patients. Everybody that's clinic staff inside the building is wearing a mask, because we also know about COVID. You can be shedding the virus and spreading the virus even when you're asymptomatic or pre-symptomatic, so even 2 to 3 days before you develop symptoms. So everybody being masked prevents those droplets from being spread, whether I have it or if a patient has it. And then we're also inside the clinic. Sometimes those patients get past the greeter and they'll be like, oh yeah, actually, I'm really worried I have COVID. And so all of our triage nurses that have kind of the first touch with the patients are also wearing the face shields. And then if they are concerned, they will send the patient back outside to the side clinic. Or, for example, if it's one of my really chronically ill patients and they want to see me, I will do all of the PPE as well and see that patient. And then basically we have a separate room where we put any suspect COVID patients, and they leave through a different entrance. And then that room is wiped down with all of the high dose stuff that's gonna like basically peel the skin off your hands. So that's prevention at Siloam. And then prevention for our community. So yes, with the reopening kind of phase by phase, the biggest thing that anybody can do is social distancing and good hand hygiene, like across the board. And so the CDC has also recommended now, and even in the governor's kind of rollout plan, that everybody wears masks in public. You don't need that big N95 painter mask. You do not need that unless you are doing an aerosol procedure on a COVID patient. So if you have them and you want to donate them, please feel free. The cloth masks are great because, like I mentioned before, many patients and many people are shedding and spreading the virus even before they know they have it. So with the cloth mask, if you have any sort of cough or sneeze or whatever, even talking, the virus spreads by droplets. So even talking, I've spit on my computer a couple times. I'm glad you guys can't see it yet, but that can also spread the virus. And so you are protecting not just yourself, but others in the community when you go out. The social distancing, 6 feet apart, because they realize that the droplets usually don't travel further than 6 feet. So that's still a really, really important thing, even when you are masked. And I will say, even though these restrictions are going to be lifted slowly in phases, I'm still going to be really cautious about when I'm going out of the house, and probably sticking to going to work. I'm in clinic 2 days a week. One is the COVID clinic outside and one is in clinic. And then work from home. I'm going to continue to do that because I know that that's the best way that I limit my exposure and limit other people's exposure. I especially encourage that if you have any sort of, or your loved ones have any sort of conditions, chronic health conditions, asthma, diabetes, heart disease, chronic kidney disease, if they're immunosuppressed, so if they've gotten a kidney transplant and they're taking all the immunosuppression drugs or they're on chemotherapy. I would highly encourage those patients, and that's also in the rollout plan for Nashville, that those patients with higher risk stay at home still. Hand washing, 20 seconds, soap and water. If you can't wash your hands, then use the hand sanitizer, but soap and water is better than the hand sanitizers. So I'm going to stop there because I can talk for a long time.
Great, thank you. If we could switch back to Amy for just a minute. I think I emailed you last night with a question that one of our members had. And you said you had some information for her about that. So can you talk about it, or do you want me to remind people of the case?
Sure. I'll give a brief overview,
Okay.
and then if I've gotten it wrong, you guys can correct me before I start answering the wrong question. So I think one of you had a case where you are sort of a mentor for a refugee family. Okay. The story that you shared in this case is something that our team is very familiar with. Lauren described one case. I lead a team of community health workers, which I've used that term several times and realized I didn't explain necessarily what that means, but community health workers are lay people who represent some group with whom they share commonality. So in our cases, they share a language and they share refugee and immigrant background status. And many times they share other life experiences. So caring for family members that live in another country, or similar socioeconomic experiences when they first arrived in the US, et cetera, et cetera. And so our community health workers, we have serving Spanish, Arabic, Nepali, and Burmese languages. And then we also have a case manager who's working with Congolese families, and they speak mainly Kinyarwanda or Swahili. And so we have these 5 frontline languages in the community health team, as well as some other staff. And all areas of our clinic are hearing situations similar to the one Sarah sent. And so in that situation, she said she was working with as a mentor to a family of, I think, 8, and they work in a food processing plant where there has been an outbreak, they carpool to work. They don't have their own transportation, and they still want to go to work because they need that money. I might be altering your case scenario, but I'm putting together the common story that I've heard in the last few weeks. And so what do we do? How do we help people who are scared to get tested and live close together and have very likely been exposed? So we have seen that a whole lot. So our community health workers have one of the beautiful pieces of this job and this role is that these are trusted members of the community. Lauren is really trusted. Patients love our providers. They tell their providers a lot. But little did we know till we started adding community health workers, how much patients sometimes keep back, even from their beloved providers. And so a lot of times our community health workers, even before COVID, would hear things like, I didn't tell my doctor, but I actually am not taking that medicine because it gives me a side effect. Or I didn't actually understand what the nurse told me I was supposed to do. How many times am I supposed to take this medicine? Or how do you do that exercise? Things like that. So the CHWs get the inside scoop. And so they've gotten the inside scoop from a lot of their patients. And I think your role as a mentor, you may have also built up some of that trust. And so our community health workers have had to do a lot of coaching and explaining on why we should get tested. So immigrant and refugee communities, I have been hearing a lot of reasons of fear to get tested. And for some of them, it is related to immigration status, some of the language that is associated, contact tracing. That sounds really scary if you don't want any government member tracking you. But to be honest, that is not the primary fear that I've been hearing. I've been hearing more around economic reasons of I don't know what I'll do for my job if I have to stop working. Or some stigma within the community. I don't want others to know that I'm positive. So if I stop going to work or stop engaging in community events, even though they've definitely, large gatherings are not happening, but just sort of being or telling other family members that they live with, et cetera. I'm afraid of what they'll say to me or how they will isolate from me. And so we're getting a lot of fear around testing. So what we've had to do is just spend a whole lot of time explaining what a test means, what some of the benefits are, and what some of the workers' rights are. So workers' rights are maybe one area that in the particular case scenario you described could be important, because the food plant that you mentioned is working closely with the health department because of the outbreak there. There's an agency that I think some of you all are already aware of, the Tennessee Immigrant and Refugee Rights Coalition. Their website is tnimmigrant.org. And they've produced some COVID materials on workers' rights. So if you wanted to go there and look and see, I'm not sure which languages they have it available in, but it is in English and Spanish, and maybe other additional languages. I'm not sure the language of your family that you're working with, but sharing workers' rights, that your employer, if you test positive, is required to give you paid time off, because that's part of the federal legislation that has come out. And then if they're struggling with additional fears with their employer, then I would encourage you as an advocate to perhaps call the health department, or I would say call the health department, particularly since they're involved in this particular employer situation, and let them know if what your understanding of the employer's response is, if it's different than the family that you're working with, if there's any discrepancies there. But really coaching them on how to get tested, why it's safe to get tested. I think another challenge that is just very real and has very, I'm at a loss as to how to coach a lot of our communities on the shared transportation challenges. So this carpooling incident. So a lot of families ride together to work or don't have their own car, or they haven't gotten their driver's license yet. And so they're riding with other people, but now the other people are either afraid to share transportation or have a positive test result and no one wants to ride with them. So that is a challenge I haven't figured out how to overcome yet, because like Lyfts and Ubers and stuff are pretty expensive. And in terms of the testing sites only being open Monday, Wednesday, Friday, it's also a challenge. The state is opening additional test sites last weekend and again this weekend. So perhaps if someone would prefer to go like on a Saturday, I know there's one in Williamson County this Saturday, maybe Rutherford County. I don't remember, I didn't check closely enough on that list. But so there could be some test sites that are relatively nearby open on the weekends. That we have had also some miscommunications around in these communities, fear that they would be charged for testing. So making sure they understand they shouldn't be charged for testing. And if they are charged, then they shouldn't pay it. If they go to one of the public health test sites, if they went to a private hospital, those are also not supposed to be charging, but I can't say walk away from those in the same way as just keep driving on through in those public sites. But those are a few of the challenges. And then our community health workers and our clinic, we're also starting to provide masks. So a mask that may not seem very expensive to you or maybe easily accessible can still be a burden for some of these families. So if you're able to, maybe in your community, you all want to do like a mask making drive, or maybe you have some people that have sewed masks. And so we've had some donations to our clinic, and our community health workers have been doing porch drop-offs and other things to get those masks out to their community members. Because as Lauren mentioned, that's a key to safely moving back out to the world.
I mean, it sounds like another part of this case was at least a perception that some of the testing centers are open by appointment only, so that you can't just go whenever it's convenient. Is that true? And is there a way around that for people who are trying to navigate that around a work schedule?
Actually, if I may, Leslie. Sorry, my name's actually Judy. This is my daughter's name.
I'm sorry.
Just last Zoom, you wouldn't know that. No, the issue around transportation was, I guess there's a TennCare associated transportation service that will take you to and from appointments.
Mm-hmm.
But all the testing centers are walk-in and you can't make an appointment. So that was one hang up as far as getting transportation. The individual in our case lives also about a mile from a hospital, so he could walk there.
Mm-hmm.
You know, if he was willing to get tested, there definitely is some reluctance, and there's a huge communication barrier. We have someone who speaks Swahili on our team, and even then, you know, getting some good communication has been difficult. So I'd be interested in your case manager that speaks Swahili getting to this family.
I was just about to offer that. So if you want to reach out, Leslie has my email address. So if you want to email me, we can connect our staff member on Monday.
Perfect. Thank you.
And I'm also happy to share the list of testing sites, not just within Davidson County, because there actually, Judy, is a Rutherford County offers appointments. And actually you have to have an appointment to get tested there. The other sites, they just recommend that you call ahead. And Rutherford County, it does not just apply to Rutherford County residents. That's something that's been really wonderful that Rutherford County and Williamson County have done. And they also, now I'm gonna pull up my document and I'm happy to forward this to Leslie as well. Williamson County, Rutherford County, you don't have to be symptomatic either. So if you are just concerned and want to get tested, that is an option there with Rutherford County. But I'm happy to send out that document so that you all, if you do get these questions on where potentially to direct patients. And like Amy said, it should not cost them anything.
Right, and that's the case even if you walk to the private hospital, they shouldn't be charging.
That is a different story. So the private hospital, I know there's one private hospital in particular that will be charging. In some cases, if they are symptomatic, so in your situation where this family seems like they've been exposed to somebody that's been positive, the health department is supposed to be reimbursing that cost for any clinic that is running that test. However, if the hospital is using their own laboratory, which is what we've seen with some of the bigger hospitals in Nashville, they're not sending it through the health department, and so therefore there is a charge potentially.
This is the TriStar Southern Hills Hospital, if that helps.
Yeah, no, that's where a lot of our patients go, and a lot of our patients want to. I think if the patient is symptomatic, and even just I don't unfortunately have the answer to that, but if the patient is symptomatic, typically the health department should cover that cost, but the hospital will have to know the billing department will have to know how to get that information to the health department to be reimbursed for that.
Oh boy. Okay. Now, since the Metro Health Department is working with the food processing plant, is there any word that maybe they will just do testing of employees at work?
And unfortunately, I was like, I can't remember if I'm muted. I was just looking at my email that I had that I'm engaged with someone who's advocating with that plant. And I'm not seeing that they are currently planning on either shutting down that facility or actually doing testing. Unfortunately, we're not hearing that yet. They should be able to get sick leave of absence if they have documentation that they have a positive diagnosis. And that facility is mailing information to their workers and trying to do some education. But we're seeing a lot of hard the challenge between the facility wanting to stay open and people wanting not to lose their jobs. So some of them don't have an option for leave of absence unless they've been diagnosed as positive. So it's a tough place for them to be in.
So I kind of feel like the way this is headed, it's so sad that these entire families are going to be infected. And maybe we just need to now anticipate how are we going to get them health care when they get sick. Because I just don't see how we're going to stop that.
Yeah. So we have our community health workers are working with some of the community members that have had positive diagnoses. So I think the fact that this family has you and your group engaged with them, making sure they have food, making sure they have cleaning supplies can be a big one, to make sure they know how to clean their facility. Unfortunately, there are not really treatment options yet. So a lot of the care is just that shelter at home. So making sure they understand what quarantine can look like. And again, like I mentioned, our case manager, I think, would be happy to jump in.
Thank you.
If I could, I'll also share, we were working with some families who had family members exposed. Are you talking at one of these processing plants? And so they were then also afraid to go and pick up food because there were food baskets available for them through various food sources, but because of their concern, they didn't want to go. So just as an FYI, if people are working with families in those situations, on a limited basis, Second Harvest will do deliveries of food. So just so that you know that, if you know of a family that is in need of that particular service, they're not really publicizing it, but we were able to work that out for some families. I'm going to go ahead and unmute everyone just in case anyone else has. I'm sorry, Sarah, were you finished? I didn't mean to interrupt.
Yeah,
I'm sorry, Judy, sorry. Sorry.
Other questions?
I'm going to unmute everyone, Leslie, and that way if anyone else has, anyone else who has questions can ask.
If not, I guess one last thing that I've been getting a lot of questions about from our community is what can we, those of us who have resources, what can we do to help? So we, other than making the masks, are there any other things that you can think of that people can do? I mean, would it be helpful if people were offering rides to take people to testing, or what else can you think of that we could do to be helpful?
Go ahead.
I'm going to speak to the rides. I think that's a very generous thing, but it's really, really important that if you're going to offer that you have a mask and the person that you are taking has a mask as well, and that you're disinfecting your car, and that if you have a large car, you should make them sit all the way in the back. And then just making sure that you're hand sanitizing and wiping down the doors and that they've touched the handles to get in and out of the car. So from a public health perspective, it is so important. But the other thing that we're also telling patients, if they can't get tested and they are calling to call their providers, because we can triage and say, it sounds like you probably have coronavirus and you need to stay home and self-isolate. So that doesn't really answer your question to help, but.
I think some other needs that I'm hearing, I love that you all seem to have individuals in mind that you're already helping. Because I think some of the needs that are most emergent are ones that are really hard to coordinate on a citywide or even organization-wide level, like giving rides or rent assistance. There are food banks and rent assistant services in the city, but as you all are aware, I'm sure the need is greatly exceeding the available resources right now. So if you're able to support the individuals that you're already engaged with, that would be great. If there, I am imagining, at least in Judy's instance, there are probably children in the household. So if you all have Metro school children yourself, you may be familiar with some of the ways that Metro is serving their student population. But, and even though these families should be getting calls in their language explaining all of these services from Metro schools, I've heard a couple things. One, that the call system had languages mixed up. So some of the families have not gotten calls in the correct language. They're working on correcting that. But the point is, if you can help them navigate the services available through Metro schools, that might be helpful to make sure that they're aware of the check out a computer that is available, or programming on Nashville Public Television, or the meal pickup sites if they need those for the kids, making sure they know about those resources. And United Way's website is the place that we're sending most people to find available resources. That's updated on a daily, every weekday at least, it's updated. It's already been translated into Spanish, and it's working on getting translated into Arabic, but not yet Swahili and a lot of these other languages. So they may need help if you've got someone who can liaise between English and the other languages, to let them know what resources are available. And then we work at a nonprofit. I don't mean this in a self-serving way, but giving to nonprofits. So if you're resourced, places like United Way has the COVID Response Fund, or if you are able to give to the nonprofits that you're already engaged in, and my development director would say, and Siloam too, so I'll do that on her behalf. But any of these kinds of places, there are lots of opportunities to give, and unfortunately, I feel like it's just financial resources are a big need for a lot of the communities that have lost their jobs. So even though that is like a low-hanging fruit, it's really a big need. So I think that's a great way that I personally have been involved and want to continue.
Let's see. Anyone else have specific questions? I was wondering, Lauren, as a healthcare provider, if you've had a chance to see the mayor's plan and what your thoughts are as a healthcare provider about that reemergence plan.
So I'm not sure if you're talking about the phased plan, where it's like phase 1 and if for 14 days. Okay. So I actually just read over that this morning. I like that in the very first column is everybody out in public should be masked. Completely agree with that. You know, I think that it is a really good plan in theory. And what I worry about is it just takes one irresponsible person that doesn't wipe down the, you know, the station that you were eating at, the table that you were eating at, and you were pre-symptomatic and you took off your mask to eat, and that doesn't get wiped down. And then I come and sit down and I am elbows on the table girl. And, you know, I think that it is really good in theory, and it is wise to try and do this in phases. I'm glad that there's going to be a check-in every 14 days if we see cases emerge. And I think that's what's going to be really important, is that if we do see these spikes after we start to reopen slowly, that we take action. And I also know that it's important for us to try and get back to whatever our new normal is. And I don't know that there is a best case scenario on how to do that. So I appreciate that they're trying to phase this in. And also, I think we we'll probably start to see some more people that test positive. But it's a rock and a hard place, right? I'm glad I'm not in a leadership position. I just show up and put on the mask and the goggles and, you know, swab your nose. It's very unpleasant.
Yeah, I will say for anyone who's listening that they suggested for my husband to get tested, which he did over at Meharry, and I have to say that that was a free testing site, very well organized, very efficient. And then they suggested that I go, even though I hadn't had any symptoms at all. Let me first say, we both turned out negative, all as well. But I went over even without any symptoms at all, and they did not hesitate to test me. So that Meharry's resource, and I guess also at Titan Stadium, also similar. So those are completely free. It really pains my heart, the thought that somebody would be charged for one of these tests. That's really not the plan. They are not supposed to be charged. So given that there are free testing sites, I hope that no one will have to pay for a test. Any other questions? Well, thank you. I know that Amy and Lauren has very busy schedules. So Leslie, I'll turn it back over to you for the final words.
Sure. I just want to thank everyone for joining us today. This was our first time doing one of these, and I think it was a big success. We learned a lot, and we'll be putting it up on our Facebook and YouTube pages so that people who couldn't join us live can see it afterwards. And just thank you so much to both Amy and Lauren for taking the time out of your day to join us. And again, I think we all learned a lot. Thanks everyone. Have a great day.
Thank you all. Stay safe and healthy. Thank you.
Yes. Bye.
Bye.